So I'm going to talk about safety planning, and safety planning is a really important piece. A few months ago, many of you might have attended with us where we talked about doing a good foundational risk assessment in your practice, and that's a Joint Commission requirement. But in addition, the other Joint Commission part of this as a national patient safety goal is to ensure that you have a documented risk mitigation plan for each individual who does screen positive for some sort of mental health crisis or suicidal ideation. I do want to give a shout out to my two colleagues, Dr. Sean Riley and Dr. Terry Maynard, who are psychologists here at the hospital, who have done a lot of work around this topic and have given similar presentations in the past as well. So you can go ahead. And very quickly, my objectives is I'm going to go through some safety planning, high level basics, and then provide kind of an overview of one particular safety plan that is evidence-based that's often used. You can go ahead and advance. So first of all, defining a crisis. This is my colleague, Dr. Riley, and probably many of us have felt like this at times. But a crisis at a high level is something that is highly stressful, and in fact defined as something that overwhelms someone's ability to cope. And so our baseline ability to cope differs in different situations, but what we know is this overwhelms our ability to cope. It is short term, and what we know is that individuals in crisis who receive services go on to continue in the community most times, and that is the goal, is to keep folks in their home, in their roles, and not disrupt them by utilizing a hospital situation. And in these crisis situations, it creates intense pressure to act to resolve that crisis, both from the patient that you're seeing and from the staff member. But what we know is that in that crisis situation, if your ability to cope is overwhelmed, using kind of a standard operating protocol as a safety plan or a coping plan is the best way. If I'm in crisis and I'm having trouble thinking, what do I do in this situation? And I have my coping plan. It might be in my phone, it might be on a piece of paper, it might be in an app. If I have that available, all I have to do is think, let me pull that up, and it's ready for me. I'm not having to think about, oh, what should I do to cope, or who should I contact? Go ahead. So I really like this quote regarding safety planning to kind of set the foundation, to put the part of you that wants to live in charge. It's helpful to plan how you'll get through those difficult moments. And that's really what safety planning is about. You can go ahead. When we look at what is safety planning, it's really a collaborative intervention, right? It is not just filling out a piece of paper. It really is a collaborative discussion to lower that imminent risk. It follows a comprehensive assessment. So you don't want to be safety planning if you haven't done a good risk assessment first. This is the second step. It's used in lots of different ways in lots of different settings. It can be used in outpatient settings. It can be used in the ER. It can be used in an inpatient hospital. It can be used by a crisis response member in the community. But the idea overall is that you're getting a personalized safety plan. And there was a study in 2016 by the VA that showed that a safety plan really is not effective unless it is individualized. It is personalized, that individual's resources, their community, their supports. Go ahead. So I want to make a really important point, and that is safety planning is not a no harm contract. And so this was, 20 years ago, what we used to do is talk about creating a no harm contract, which if someone came into me, I would say to them, okay, I'm going to have you sign this piece of paper that says you are not going to kill yourself until you see me again. What we know is that there is very little evidence base for that as an effective intervention. What we do know is that a safety plan is actually an evidence-based risk reduction strategy that is a collaborative process. It's a discussion. It is a development of a coping plan and a crisis response plan. It is recovery oriented. The primary goal of that plan is to instill hope by offering options for coping. When someone gets to the point of considering suicide, they're considering that because that is a way to solve their problem. The problem is intense, overwhelmed distress that they don't have another option to solve. And what you're doing is you're increasing their available options to help solve that problem and cope with that crisis. So it's a tailored, individualized plan. Go ahead. That can be done in a multitude of ways. I listed these because I want you to see a couple of options. I want to focus on the safety planning intervention, which is the Stanley Brown. Go ahead. And CAMS is another great model. I could give a whole talk on CAMS. It's a really, really great evidence-based intervention, but I'm going to talk about the Stanley Brown safety planning intervention as identified as the SPRC, the Suicide Prevention Resource Center, as a best practice. You can go ahead. So this is kind of the overview of safety planning intervention, and it's really designed to be brief, like a 20-minute in-clinic collaborative discussion. Can be done by anyone, can be done by a physician, an advanced practice provider, a psychologist, social worker, a nurse can do these. It's typically done in a variety of settings, and it complements that risk assessment. So you can see left to right on the bottom, what you're really doing is identifying that risk, and then you're obtaining that crisis narrative. What's going on? Then you're introducing that safety plan, and you're describing a risk curve going all the way through to follow up at the end. I'm going to talk most specifically about that crisis, that safety planning and the crisis narrative. Those are really important foundational pieces of this. You can go ahead. I'm not going to have time to talk a lot about the evidence base of this. However, what we know is that people who receive an intervention in response to a mental health crisis, or specifically suicidal crisis, are 50% less likely to attempt suicide if they receive some sort of intervention. That is huge. Many of our medications don't have that level of impact, and we know this can be really effective. So I want to stress that point, that this can work, and this can actually reduce the risk of someone going on to attempt suicide. Go ahead. So again, that assessment, I'm going to highlight that. You can have access to these slides, gladly share them. These are different options for assessing risk, but the Columbia is the one that we use at UK Healthcare pretty extensively. I know lots of other organizations do as well. That's that third one listed there. Go ahead. So when you're looking at that assessment, you've assessed someone, they have increased risk, you've identified they have some suicidal ideation. What you need to know next is what's going on. They may or may not need an emergency room visit. They may or may not need hospitalization at that point. And so through safety planning, we're going to pull that out a little bit. That crisis narrative is really the context and the foundation. You, as the person talking with them, have the ability to then pull that in to pieces of the safety plan. It tells the story. What has happened that has led them to feel hopeless and so overwhelmed? And you're kind of starting this story backwards from where we are today. Take me back and help me understand what's happening. What are the triggering thoughts? What are the feelings, the sensations, and what are the decision points that lead us to believe that suicide is the best potential or a potential out? Go ahead. So when you're introducing safety planning, what you're talking about is some short and long-term goals. So it's having a crisis plan ready, and you're saying, hey, you know what? If I need to have a backup babysitter, I'm going to have my list of options, right? It's the same thing here. If I get into a situation where I'm experiencing suicidal thoughts, I need to have my options. I need to know what's happening. And so it's these short-term, immediately reduce that distress, and these long-term, how am I going to cope and use my support system? Go ahead. So the components here of the actual safety plan are warning signs, those coping skills, distracting, either with people or social settings, and then going through to who else do you contact? And that's, my colleagues are going to talk about that a little bit more extensively. And then that lethal means restriction. Go ahead. So when you're looking at warning signs on each of these slides, I've added questions about how you might ask these questions. So how will you know when you need to use this? What do you experience when you know you're in crisis? How do you feel when you're depressed? You can go ahead. And then when you talk through those with the person, you're then going to say, okay, so how can you cope with that? What do you have that helps you feel differently? What activities could you do to take your mind off this for a little bit? What can you do if you feel like you want to act on this? What are your coping skills? You can go ahead. And then how would you be able to use those skills during a crisis? So you want to also identify barriers. What if I don't have my coping skills with me? What if I'm at work and I don't have the ability to step away? How would I cope in that particular situation? Go ahead. And then using the people around you. So people are used differently. People are used as support. I might be willing to go to someone I'm close to and say, I am feeling suicidal, but I might not be willing to tell them that. I might just say, hey, could we go out and go for a walk, and maybe not share the level of detail with them. And so you want to talk through with them, who would you talk to and what would you talk to them about? And how can they support you? Go ahead. And this is exactly that. Who would you contact if you needed to share this information or ask them to help you get support? Or who would you contact to be willing to say, yeah, I'm really in crisis here? Go ahead. And then who would you contact in the community? I'm not going to belabor this because my colleagues are going to talk more about this, but we need to have a plan for who are my resources in the community. Go ahead. And then lethal means restrictions. And this is really important. And you actually document this, I'll show in a second, on the safety plan. Do they have access to a firearm? You really want to talk about that, and how do you work with the family? That is in Kentucky something that's really important. I don't have time to go into tons of detail about it, but you do want to assess, what are you thinking about doing to harm yourself, and how can we lock up your medications or reduce access to weapons or things like that? Go ahead. And then the last part of this that I think is really, really important is, who or what do you have to live for? And this is a really powerful question for instilling hope in folks and helping them understand, what is my meaning? What is my purpose? What is important to me that I can identify as a protective factor? Go ahead. So in the last minute or two, I just want to run through, and again, I'm happy to share these slides, what this looks like. This safety plan, the Stanley Brown safety plan, is widely available online. It's easily accessible. And in fact, some EHRs are actually have it built in. So you could look in your EHR that you use to understand whether or not this is already available to you. You can go ahead. Each section is broken down into the warning signs. So you can see those written out there. You want to identify at least 3 thoughts, mood, behavior, situations that are warning signs. Go ahead. And then you have those internal coping strategies that I've talked about. Go ahead. And those people and their contact information. So I don't have to go through the effort to look them up, to find their phone number. They're readily available. Go ahead. And then individuals who I can actually ask for help, to say, I'm in crisis, I'm needing support here. Go ahead. Actually, as a side note, I have a lot of my folks create a list in their phone of contacts and just put them in their quick contacts so that they can quickly call them and easily get a hold of them. And then I'm going to turn it over in just a minute to my colleagues who are going to talk about this, but this is where you want to identify your local resources. This is a bit of an outdated form. 988 is now the number to call, and I know Darcy's going to share that at the bottom. Go ahead. And then talking about means restriction and environmental safety at the end. Go ahead. And at the very end here is the reasons for living, and this is really important to make sure that you have something on there. And the last slide, I believe, for me is where to find more about the safety plan, some additional resources on how to do this. This is something that can be a really powerful 20-minute intervention. I'm happy to answer questions at the end. I want to make sure to give my colleagues time, but this is something at a high level that can be used really easily and really effectively in any practice.